Do you have thigh pain? You know, one of the most common reasons why patients after a total knee replacement develop thigh pain is because of tourniquet use, but not every surgeon is using a tourniquet these days, and patients are still developing thigh pain. So if you guys don't know me, my name's Tony Maritato. I'm a licensed physical therapist, and I share videos helping patients following a total knee replacement get answers to the questions they have. I was in the clinic the other day, literally I think it was Friday last week, and I was working with a patient. I've shared some short videos of his situation. He recently had surgery. He's about a week and a half to 2 weeks post-op, and he continued to experience and report thigh pain. So it was lower than I would expect the pain to be associated with the tourniquet. It was just barely above the knee, down low on the upper thigh. And so I was thinking about what other causes there might be for his particular thigh pain. It was a muscular type pain. It wasn't nerve related. There were no other issues. It wasn't a superficial kind of pain that's in the skin. It was deep in the muscle belly. But something that was interesting is this individual had pretty good range of motion. Less than 2 weeks post-op, had at least 90 degrees of flexion and almost full extension. But he's a very guarded individual. And if you guys have been going to therapy, you know that your physical therapist is probably telling you, relax, relax, relax. You hear that word a lot in physical therapy. And so with this individual, I had him seated. I do a lot of my stretching while the patient is seated. It's just more comfortable for most patients. And I'm holding his ankle. And I'm nowhere near end range of motion. I'm holding him probably 50 or 60 degrees of flexion. I know he's got 90 degrees. And he's stiff. And I'm looking at him and I'm talking to him and we're not stretching and I'm not even moving his leg. And I said, you know, why are you so tense? Why don't you relax? And the way that I know primarily is I barely even feel the weight of his foot. He's a bigger guy. His legs should weigh at least 20 pounds. But I can't feel anything. I feel maybe a pound. I feel the contact of his foot in my hand, but no real weight to it. So I know he's tense. I know he's holding it up himself. And I'm like, look, relax. I'm not going to do anything. I'm not even going to move your foot. I'm going to hold your foot right here. I'm not going to let it go anywhere, but I need you to relax and let me feel the weight of your lower leg. And he just could not do it. And so it got me thinking about that. And mind you, I've been in this business a long time, but I always learn new things. And so as I'm thinking about it, I'm like, if he's this tense that he can't relax, even knowing 100% that I am not going to move his leg, my assumption is he's probably like that most of the time. He might not even be aware. He's not trying to be tense. He's just tense. And so if you can imagine, and the way I try to describe this is, if you asked me to pick up a gallon of milk, I could get it out of the fridge, I could hold it at arm's length, and I can feel it. It's 8 pounds, it's gonna have some weight to it, but my muscles are able to do that. But if you told me to hold that gallon of milk arm's length for 10 minutes, my muscles would begin to burn. My muscles would ache, they would become sore, they would become painful. If you told me to hold it like that for 24 hours, for 5 days, at some point the muscle becomes so worn out, so fatigued, almost starting to cause damage just because the muscle is overworked because it's constantly tense. I feel like that's what's going on for this particular patient and probably lots of patients out there. You might not realize that you're maintaining this level of tension because you're not aware of it, but that tension is forcing the muscle to work without ever getting a chance to relax. So your physical therapist is going to know when you're tense and when you're not. We can feel it in our hands. We can tell just by the way you're moving. And so one of the things that I would tell you is the soreness you have in your thigh might not be attributed to a tourniquet. Maybe your doctor didn't even use a tourniquet. It might simply be because of the tension you're keeping in that quadricep muscle because the brain, the nervous system, subconsciously is so scared to let that knee bend and feel that pain at end range that it's just forcing it to stay in one position. And I know I've seen this for patients that have poorly controlled pain management. I know that I've seen this for patients in other conditions where they're just so fearful of bending the knee, and rightfully so, because when they do get to end range of motion, it absolutely hurts. Some patients are fearful to bend because they think that the incision is going to open, or they have staples as a closure method, and they don't like the sensation of feeling the staples pull against the skin. So there's lots of reasons that a patient would be less than eager to allow the knee to bend on its own. But I just wanted to share that. I think a lot of the soreness this particular person is feeling is because that tension is just always in there and he hasn't figured out how to let it relax. Now, there are strategies. Your therapist can help you with that. This video is mainly intended to just share somebody's real life situation and what they're dealing with, and hopefully that little bit of information helps you.